You're listening to Health Professional Radio. My name is Wayne Buckler, and today my guest is Dr Nick Wallwork, who is the chairman of SPORTSMED-SA, Hospital and Orthopaedics Board of Directors, and an orthopaedic surgeon. So, welcome to Health Professional Radio, Nick.
Thank you very much.
Nick, give us some idea about where you are and what geographical footprint you fit into, and what it is that SPORTSMED does.
SPORTSMED is a orthopaedic service provider. It consists of a group of 13 surgeons who work in a combined practice which covers both the clinic providing basic outpatient services and also operates a hospital. The hospital is based in Adelaide in South Australia and has approximately 300 employees, runs 5 operating theatres throughout the week. We also have satellite branches both in the suburban suburbs of Adelaide and also have a presence up in Adelaide. And we provide sort of research and educational opportunities to surgeons from all over the world.
Right, that's in my mind. I had a much smaller operation. You know, a 300 staff hospital is a big operation.
It is, and part of the problem, the reason you need so many staff is to run 24 hours of care. So we run a hospital that obviously is staffed throughout the time period, and that involves a large number of people and personnel for our organisation. As well as that, running branches and clinics and outpatients, then it very quickly adds up to the number of locations and people required to run the service.
Now, SPORTSMED kind of suggests orthopaedics associated with sporting and sporting injuries. Are you restricted that way, or do you cover the full gambit of orthopaedic work?
We cover the full gambit of orthopaedic work. I mean, obviously a large amount of the elective work relates to arthritis and degenerative conditions. So probably the majority of surgical work is actually related to a more of a degenerative process, an older portion of the population. However, the clinic was originally designed to provide excellence in sporting care, and so catering for high-level sporting teams and the acute sports trauma has always been a priority of the practice.
Dealing with inflammation-based illnesses is certainly one of the chronic tsunami of things we keep getting told about. I guess you expect that to be a larger and larger portion of the clinic's work.
Well, certainly from South Australia, which has an ageing population and ageing demographic, and we are seeing more and more of the degenerate or inflammatory type conditions becoming a high proportion of the work. I mean, that's in combination with an older population and more sort of higher injury demand as well, from greater demands of sporting life into the later life.
Nick, what is it that you'd like clinicians who might be listening to us today to take away from our chat?
Well, I think probably one of the things I find is most important is that people perceive quality services being expensive, and what we try and deliver is a very high level of quality of care, but at an efficient aspect to it, and that means that the price is obviously, and the cost of healthcare actually reduces by delivering a more efficient process, which means less waiting for the person and the patient. So we really believe that we can reduce the amount of waiting times, reduce the amount of delays between diagnosis, treatment, and effective return to activity by making a more efficient service. And in turn, that provides a greater cost saving and also provides greater quality of care.
You're listening to Health Professional Radio with Wayne Buckler. My guest today is Dr Nick Wallwork, who's the chairman of SPORTSMED-SA, Hospital and Orthopaedics Board of Directors, and an orthopaedic surgeon. Nick joins us from Adelaide in South Australia and has just been talking about the efficiencies that the hospital's able to offer from having Nick, a consolidation of all of the carers necessary in one place.
Yes, so we provide radiology services, we provide primary care services, physiotherapy, rehabilitation, gym, and the whole gamut of orthopaedic services to rehabilitate a patient back to their function.
Now, in every industry, Nick, in every situation, there are always misconceptions. What are the misconceptions amongst your customers, clients, patients that drive you nuts and keep you awake at night? In
terms of the overall business structure in healthcare, I think people people do have an expectation that from injury or from accident or from a degenerative process they can regain full function. But unfortunately, the biggest misconception is that you become perfect afterwards. There is always a recovery and a healing process, and what we're looking for is improvement rather than a complete return to the pre-injury level. And I think an acceptance of what we can deliver is probably equally important, so the expectations are met.
I can understand why that is a misconception that would keep you thinking about how to solve that, and maybe today we can educate a few people and change that a little bit for you. Nick, it's been a pleasure having you with me on Health Professional Radio. How can people get in touch with you?
So we're contactable in Adelaide with the direct clinic number, which is 8130 1100, and we're certainly happy to see people for any issues they may have.
So I'll just repeat that number. That was Adelaide 8130 1100. Is there a website where people can get in touch with you?
Yep, certainly at sportsmed.com.au. And
because I'm always getting in trouble for never giving people notice, fair notice listeners, pencils ready. It's www.sportsmed.com.au.
Yes.
Nick Wallwork, thank you very much for your time this morning. If you just missed our conversation, you'll be pleased to know there's a transcript of it available on our website. There's also an archive of the audio on SoundCloud and on YouTube, and our website is www.hpr.fm. My name is Wayne Buckler. This is Health Professional Radio.